So yesterday we talked about the internal things which are present inside the layer called dermis. In the dermis, we have many things that are called hair follicles. Okay, we talked about hair follicles. And next we talked about nail follicles. Okay, and receptors, important receptors, what are present in dermis. And we talked about glands. Two types of glands are sebaceous gland and apocrine glands, Purminous gland. Okay, these are the three types of glands which are present in below dermis. Next, we will talk about today blood vessels. Okay, what are the blood vessels which are present in dermis? Okay, next we will talk about. Next, we have another layer that is called subcutaneous layer. So this is the third layer. First layer is epidermis, next is dermis, next is subcutaneous. Then we have muscular, then we have bone. So before bone, we have one layer, two layers, three layers, four layers. So we have to cut down the four layers, then only we will enter into bone. Okay. So today, let's talk about blood vessels, which are present in dermis. Okay. Beside the capillaries in the dermis, the other blood vessels of great importance are arterioles. Okay, arterioles are small arteries, and the smooth muscle in their walls permits them to constrict or dilate. So basically, the end part of the arteries are called arterioles, means small arteries. This is the large artery aorta. Then we have the sub branch here. Okay, then we have the small branch, and we have in mild small branch. So this end part of artery is called arterioles. Okay. So basically in the arterioles, there are the smooth muscle. Smooth muscles have the capacity to constrict and relax. So there's the reason arteriole can dilate and constrict. Okay. So this is important, very, very important for us to constrict or dilate the arterioles. Why? Because to maintain the body temperature. To maintain the body temperature, because blood carries heat, which is a form of energy. Okay. So we have a blood. In the blood, we have heat. Okay. So to remains the heat stability, so this function is given to the arterioles. So whenever they need, they will dilute. Whenever they need, they will constrict. Okay, this thing we have to remember. In the warm environment. So if the environment is warm, what did our body arterioles do? Okay, they vasodilate, means their vessels. Vaso means vessels. Dilate means dilution. Okay, their vessels are diluted. Okay, then what happened if the vessels are diluted like this? Then the blood flow is increases. Then the blood flow to the epidermis and dermis increases. What will happen? We have sebaceous gland, we have sweat gland. Then the sweat glands release sweat. So this blood heat is carried away by the sweat gland, and sweat glands release sweat. Then we will feel cool for ourselves. Okay, then the heat is evaporated. Okay, this thing will happen to our body in the warm condition. So there is the reason in the warm condition, warm environment, in summer season, we have highly sweat. Okay, highly sweat. Whenever we walk, we go to our home on the bike or going on the road because of vasodilation. So we have to remember that. Next, what happened? That vasoconstriction. Vasoconstriction means this is the normal blood vessel. This is the vasodilated. This is the vasoconstricted. Vasoconstricted will decrease the flow of blood through the dermis. Means here the dermis, these are the arterioles. So then the blood supply to the dermis decreases. Then the blood supply decreases, the dermis, the sweat glands doesn't sweat more. The sebaceous gland doesn't release the sebaceous uh, substance onto the skin. Okay, so their function decreases. Why? This is because of the less blood flow. Okay, you have to remember that less blood flow, the dermis, because in the winter season mostly our body need hot temperature. So there's the reason body doesn't release it heat from the body. Okay, this thing we have to remember. Because of to maintain homeostasis. This condition is known as homeostasis. Okay. So these things are controlled. Which organ is controlled? These things are controlled by nervous system. Okay. These changes can often be seen in light-skinned people. Flushing, especially in the face, may be observed in hot weather. In cold, the skin of the extremities may become very pale or as blood flow through the dermis decreases. So that's the reason people look pale in color because of decreased amount of blood flow on their surface. Okay, in cold, the skin of extremities may become very paler as blood flow through the dermis decreases. Okay, in people with dark skin such as the changes are not as readily apparent because they are masked by melanin in the epidermis. So most of the people who are dark in color, we are not able to see what happened on their body because they are dark in color. The epidermic layer are covered by melanin. Okay, vasoconstriction in the dermis may also occur during stressful situation. So when the vasoconstriction occur also, it will occur also in stressful conditions also. Why this happening? Because for our ancestors, stress usually demand a physical response. Why? Because it will need physical response. Either stand and fight or run away to safety. This is called fight or flight response. So whenever stressful condition appear, okay, whenever stressful condition appear, so what happened that our body, okay, our body want to fight with that condition. Our body want to run away from the condition, or it will save itself. Okay, so these things will happen. Why this happening? Because our nervous system will program like that. Okay, vasoconstriction in the dermis will shunt or redirect blood to more vital organs such as muscle, heart, brain. In times of stress, the skin is a relatively unimportant organ and can function temporarily with a minimum blood flow. So why this is happening? Because most of the vital organs in stressful condition need more blood. Why? Because they are functioning. Our brain want to control all the body. So we need 24/7 blood flow. So when we want to run, it will work more consciously. So the brain, liver, heart, kidneys, and brain, these are the four vital organs, need more blood flow. So body thinks that uh, skin doesn't need blood flow. So he tries to decrease the blood flow to the skin layers and it will focus more on vital organs. So that's the reason blood flow decreases on stressful condition to the dermis. You have probably heard the expression broke out in your cold sweat. May even have felt in a stressful situation. So sweating feels cold because vasoconstriction, the dermis make the skin relatively cool. So in that condition, most of the people feel coldness in the stressful condition. Their body will have very sweating. Means sweating means very cold. They will get shivering also sometimes. Okay. Blood flow in the dermis may be interrupted by the prolonged pressure on the skin. For example, a hospital patient who cannot turn over by self by developing a decubital ulcer. Decubitus ulcer, also called a pressure ulcer or pressure sore. Okay, what's happened that this is the skin, epidermis and dermis, subcutaneous and muscle and bone. So if the blood flow to the epidermis is decrease. So what happened that it will doesn't get proper amount of oxygen and vitamins. So what happened when you will put the patient on the bed, it will not able to move one side or another side. What will happen in the back side, mainly back side posteriorly, mainly what happened that the skin get damaged and patient will get pressure sore. Okay, so you will get bed sore, the skin will damage. So we have to try more amount of blood flow to this area to cure this particular ulcer. Okay, mostly in sacrum area, buttocks, lower back, the ulcer will happen. Okay, so this is a dead tissue. So we have to remove or we have to heal this area with some type of ointment or EH medicines. EH medicines will work wonderfully here. So we are talking about skin. So we can use S3, C3, okay, and GE are the best remedies for skin. And if A2, C5, GE also very good work on this type of ulcers, dead tissues. Okay. If the involvement of arteries are there, you can add A1. If the involvement of venous is there, so you have to improve venous arterial function. We can add also A1 also here. A1, S3, C3, G. Okay. If you're seeing that lymph working is not well, you can add L1 also. If you want to supply proper amount of oxygen here, you can add a P group. Okay. So like that, the electrohomeopathy works in the condition. Okay. So this is all about dermis. We talked about more about dermis. So next we have two common disorders. Okay. We doesn't complete it at now, so we'll talk about that. We will talk about. So I will conclude by this completion. Okay. So I have some work today. So common skin disorders. What are the common skin disorders like impetigo, eczema, warts, fever, blisters? First, we will talk about impetigo. Bacterial infection often caused by streptococci or streptococcal. The characteristic postures crust as they heal, the infection is contagious to others. So impetigo is caused by which type of bacteria? Streptococci. Okay. Streptococci. So crust they heal, the infection is, and it will cause other also infection. Okay, we have to remember that impetigo. Next, we have eczema. Eczema is the most common and mostly seen in the patients. Okay. Eczema is a symptom of what is more probably called atopic dermatitis and also known as atopic dermatitis. This may be an allergic also. So eczema is also known as atopic dermatitis. Mostly it will by the allergic condition also. Okay, mostly common in children and as well as sometimes adults also are. Okay, it have a rash and itchy and may blisters or ooze also. Sometimes blisters also seen here. Okay, you can see blisters like that also. Okay. Eczema may be related to food such as fish, eggs, or milk products, or inhaled allergens such as dust, pollens, or animal dander. So sometimes the eczema is come with other sources like fish, egg, milk products, or inhaled allergens like dust, okay, pollens, or animal hair. Okay. Okay. Sorry. Okay. Prevention depends upon determining the what the child is allergic and eliminating or at least limiting exposure. So here, the eczema may cause from uh, allergic conditions. Okay, first thing, and it may be from allergens or any products. Okay, sometimes some other peoples have this condition, so other people get that. Okay, so eczema is most common. For eczema, you can use the and due to the if the allergic is condition is then you can use S3 C3 verban also very well G also A2 C5 G verban. Okay, and you have to if we have most heat on the liver you can use S5 C5 also. Okay, next we will talk about warts. What are the warts? Caused by virus that makes epidermis cell divide normal, producing a growth on the skin that is often raised and has a rough or pitted surface. Warts are probably most common on the hands, but they may be anywhere to the skin. Plantar warts on the sole of the foot may become quite painful because of the constant pressure of standing in water. So mostly warts due to the virus, okay, which will cause pain. Sometimes it will divide rapidly with these here warts, okay, okay, due to the virus, okay. In the mostly in painful condition in on the plantar palm region. Palm region, if this is the palm, if this is here, you have some side of warts, then if you walk, you will get the pain. Okay. So these things we have to remember. Next, we have fever blisters. Fever blisters caused by herpes simplex virus. So how the fever blisters caused by simplex virus, to which most people are exposed as children. An active lesion usually at the edge of the lip. So sorry, here we have fever blister. Okay, this is the fever blister. This is the eczema, mostly common, and these are the warts, and this is also a fever blister. Okay, fever blister, which most people are exposed as children, an active lesion. First, we call lesion. Okay, blisters. After the secondary form of blisters is lesion. Okay, usually at the edge of the lip, but maybe anywhere on the skin is painful and have pain. Okay, oozes. Why we have pain? We have the sensory receptors which will bring there is any type of changes. You have to act. Nervous system, you have to act. You have to take the treatment. So there's the reason nervous system give you signals. If not destroyed by the immune system, the virus hide out and become doormat in the nerves of the face. Another lesion weeks or months later will be triggered by stress or another illness. So basically, if you this type of virus or bacterial infection, if we are not treated, it will enter into our body and it will damage our nervous system, which will cause more serious problems. So that's the reason we have to very conscious about that. So what type of problem is that? How we treat? How can we get rid of these problems? Okay. So let's. I hope that you understood this topic, common skin disorders. Okay. And in the skin chapter, in the epidermis level, dermis level, and has subcutaneous. Okay. We will talk about subcutaneous in the next class. Okay. Here we have the injection syringes are there. Some injections are giving by subcutaneously. These are the these are the intramuscularly. These are the intramuscular. These are the muscles. These are the subcutaneous. These are the epidermis. Sorry, this is the epidermis. This is the dermis. Okay. So we have one topic. Okay. We will cover in coming classes. Okay. Next we will conclude that our integumentary system is complete. Okay, friends. So we'll conclude here only. Okay. Okay. If any doubt, you can ask.